My name is Alyssa, and I'm doing early intervention in home feeding and language treatment this semester for my practicum placement. A is a 2-year, 2-month-old male who is currently living with a foster family. He is currently being treated for feeding difficulties and a language delay. He was born at 25 weeks premature. He was born about 15 weeks early. He weighed 1 pound 7 ounces, and he remained in the NICU for about 6 months. He experienced 3 brain bleeds, one of which was a level 3, which meant that his bleed directly involved his brain tissue due to his prematurity because the blood vessels in the brain were underdeveloped. He is currently being fed by a G-tube, and he has a trach, which is currently capped, and he is set to get his trach out in about a week and a half. He presents with feeding difficulties and a language delay. He has severely delayed oral motor skills, and because he's being fed by a G-tube, he has inexperience with food in his oral cavity. So we do taste trials with stage 2 purees, but most of his nutrition comes from his G-tube. With his language delay, he imitates sounds, he has a limited lexicon, and he signs some basic words. He underwent an extensive assessment at 16 months, 13 months adjusted. So when a premature baby is under a year old, they adjust for the time that they were born early. So technically at 13 months, he was 2 standard deviations below the mean for fine motor skills, 2 standard deviations below the mean for gross motor skills, 1.5 standard deviations below the mean for cognition, and 1.5 standard deviations below the mean for social communication. His most recent swallow study that was done on March 24th of this year revealed a severely impaired oral phase. He demonstrated impaired labial, lingual, and buccal strength, coordination, range of motion, and sensation. He also exhibited episodes of intermittent gagging. He was unable to propel the bolus from his oral cavity to his pharyngeal cavity without gagging, and he exhibited residue in the lateral and lingual sulcus. So since he has an inexperience with food in his oral cavity, his gag reflex has not moved to the back of his tongue. So he has an immature gag reflex that's towards the front of his tongue, which doesn't allow him to tolerate food in his oral cavity for very long and move it to the pharynx. The pharyngeal phase was unable to be assessed because of the severely impaired oral phase. During intervention for feeding, our goals are to increase his oral motor skills, to have him demonstrate hand to mouth for feeding, so that's just bringing the spoon up to his mouth to feed himself. We want him to tolerate dry foods and tolerate increasing bites of stage 2 purees. We're currently following the SOS approach to feeding, which stands for Sequential Sensory Approach to Feeding, and it's basically just a hierarchy of interactions and experiences with food. So it starts with just tolerating the food, it works through interactions with the food, smelling the food, touching the food, and eventually tasting the food. Right now with purees, he is at the stage of tasting them. However, with dry foods, he's just tolerating them, touching them, and smelling them. For language intervention, we want him to identify objects, imitate sounds, use one-word productions, and respond to yes-no questions. Currently at 26 months old, he should have an expressive vocabulary of about 50 words. He has maybe 5 to 7 words that he uses regularly. He should also be answering yes-no questions and responding to greetings and stringing together 2-word phrases. A sample lesson plan for him we go into the home for 50 minutes 1 time a week, and we start with feeding treatment. We start with taste trials of stage 2 purees. So we have him in the high chair hooked up to his G-tube for feeding so that he knows when he's in his chair it's time to feed, and he can feel the sensation of his stomach getting full while he's eating. We start with the purees on his high chair and have him play with them, get his hands messy, and we give him tastes of the purees. We're really careful not to sneak in bites, and we want him to have a healthy relationship with food, so we want him to readily accept the bites that we're putting in his mouth. We're also practicing hand to mouth coordination with a dry spoon. So we show him that there's nothing on the spoon, we put it in his hand, we have him kiss the dry spoon, touch his face with the dry spoon, put it in his mouth if he will, just do everything with the dry spoon so that he's getting the pattern of bringing it from the high chair to his mouth. We're also having him interact and touch the dry food, so at the end of the session we'll put like Gerber puffs or crackers on the high chair, and we'll crunch them up, and we'll kiss them, and we'll put them on our face, and we'll do everything with them, except for he won't bring it to his mouth just yet. But we will put them in our mouth and show him that it's okay to put the food in your mouth. So we're working towards getting him to put dry foods in his mouth. For language intervention, we move to the floor and do play-based language intervention. We have him imitate one-word productions, so we have flashcards of basic pictures on them and have him imitate the words that are on the flashcards. We'll also have him point to a word from a field of two and then verbally produce that word. We have him imitate sounds, so for example, we'll blow bubbles and we'll pop, 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 and have him imitate those sounds. And throughout the session, we ask him yes no questions that he can respond to. For example, do you want down? Do you want another bite? And stuff like that. So, responding to yes no questions is happening throughout the entire session. I predict further success with feeding following the removal of his trach to allow for better hyolaryngeal elevation and excursion during swallowing. So right now the trach is pulling down on his larynx and not allowing him to fully lift it up for the swallow. I also predict further success with feeding following the SOS approach. He has shown a lot of success with it in the past, so just working through that hierarchy and getting him to accept more bites and more tastes and tolerate purees as well as dry foods. He will continue to be fed by the G tube. There are currently no plans to change that, but I predict once he can accept more food orally and move through the development of that he will no longer need to be fed by a G tube. I also predict that his language will develop with further intervention and just keep suggesting things to the parents and having them work with him at home as well. And there's studies been shown to that when an infant's core strengthens, that their language improves at a faster rate. So he's working with a PT to get a stronger body, which will in turn hopefully develop his language a little bit further. And I also predict that his language will develop more after his trach is removed in about a week and a half.